An all too familiar tale, the NHS at tipping point. An elderly woman brought in last night with pneumonia by her daughter. Kelly Clayton couldn't believe what she was seeing.
45, 50 beds, corridor, left, right, everywhere. 2 paramedics to each bed. Terrible. 50 odd paramedics all in one area for a few hours. I just feel so bad for the NHS. It's really bad how they've been treated.
What Kelly says she saw is just one of many stories from citizens who rely on the NHS for their family's health. Legitimate, one may then think, to ask the Prime Minister if he has private healthcare, a private GP, for example, a question he repeatedly refuses to answer.
It's a distraction from what the real issue is, and the real issue is, are we making sure that there's high quality healthcare available for the country? But when it comes to the private sector in general, we should be making use of the independent sector. I don't have any problem with that whatsoever.
Indeed, these ideas are nothing new, with the Health Secretary reportedly now considering bulk buying beds in private care homes to ease the pressure on A&E. The role of private medicine isn't just an issue for the current Prime Minister, the current government indeed, but Labour too. Everyone's agreed that something has to change to fix the current crisis. But how to do that in a sustainable way, in a way that protects the long-term interests of the NHS?
The immediate problem is obviously the waiting lists, and one of the issues that we've looked at is whether or not we're using the private sector effectively. A number of people do go as NHS patients to the private sector. Our research shows that that's been underused and we could do more of it.
In the context of strikes, though, this is even more of a hot potato. What's the end game? How to make sure the public purse doesn't just subsidise the private sector? For the NHS is in crisis now. Ambulance workers walk out next week, junior doctors ballot, and nurses strike the week after. Unless, they say, the government comes to the table, which they believe may now happen.
We're about to start a new pay settlement round for this year. Right, we're about to start that independent process, and before that process starts, the government is keen to sit down with the unions and talk about pay.
We in the Royal College of Nursing think there has been a shift today from the Prime Minister, and that has given us some optimism, and it's optimism that every single nurse working today and tonight needs to move this forward.
So you think something has changed? The government is ready to talk?
Well, he said today very clearly that he wants to have talks, and those talks need to be about the current year, 22-23, and address the pay issues for nursing staff.
This same issue is playing out in Wales, with the Labour government there offering nurses a one-off payment to come to the table. One thing's for sure, across the NHS, wherever you are, what will improve without talking?
Well, I'm joined now from Manchester by Dr. Vivek Trivedi, who's co-chair of the Junior Doctors Committee at the British Medical Association. Dr. Trivedi, welcome to the programme. We're hearing a lot of talk about the NHS being in crisis. How are you and other junior doctors experiencing that crisis?
Yeah, so junior doctors have had their pay cut by more than a quarter over the past 15 years. And we're seeing that this is leading to doctors being driven away and contributing to the workforce crisis that this country is facing. And it's frankly quite sad and disappointing that the government don't want to do anything to address this.
OK, I'll get into what the government is saying in just a second, but can you just give us a sense of what it's actually like on the front line in hospitals? I mean, we heard a little bit from patients in Kami and Zeram's report there.
Sure. So anyone who's been to a hospital recently will know that it's taking longer and longer to see anyone if you have to present to A&E. If you're on the waiting list, this is a waiting list for an operation or a clinic appointment. These times are only getting worse. The quality of healthcare that we're being able to provide as a country is reducing, and that's because the government is underfunding both services and wages.
And just explain to people who are walking into emergency departments or struggling to get the right care in the NHS, why should the pay of junior doctors matter?
So the pay is a huge factor in how junior doctors feel valued. Junior doctors, they're only junior by name, but these are doctors who are seeing you in clinic, managing you when you're coming in unwell to the hospital, performing life-saving operations. To have your pay slashed by more than a quarter over the last 15 years shows that we have an employer that simply doesn't value us. And this is leading to doctors being driven away. So we have more than 100,000 vacancies in the NHS at the moment, and more than 9,000 of those are doctors. We need to do something to fix this retention issue. We're losing doctors and we need to fix this problem.
Now, you are proposing strikes potentially come spring. Rishi Sunak today has said that he's open to a pay deal that is responsible and affordable. I mean, he was talking about nurses. Presumably, he would apply the same principle to junior doctors. Does that make you rethink the idea of strike action?
So we've written to the government and to the various secretaries of states that have come over the past couple of months. And again, it was disappointing that we'd heard nothing from them for months and months and months. We're now being told that they're willing to sit down with us this week, but it has come too late. We're going to be balloting for industrial action. I do hope these talks that the government wish to hold are productive. I do hope they come into these talks sincerely and are not just trying to show that they're making an effort. But if they are willing to make an effort, our door is always open.
Well, at the same time as the Prime Minister's saying this, we have heard England's Health Secretary, Steve Barclay, talking about introducing legislation to make sure that there are minimum levels of staff in critical services. Would that affect your plans to strike?
So, firstly, I think it's laughable, really, that they're trying to introduce this as a way to potentially quash strike action. Doctors and healthcare professionals are working well below minimum safe staffing levels already because of the workforce crisis that we're already in. And rather than trying to fix the issue, they're trying to put a plaster over it. When doctors ballot, and we'll plan to strike, we will do so in a way to maintain patient care, but we do need to have our voice heard.
OK, Dr. Vivek Trivedi, thank you very much for joining us.